Hi everyone, Nurse Mel here. Hope y'all having a great day. This video will be comprised of all things COVID-19, aka coronavirus. This video will be targeting the outbreak that was first hosted and reported in December on the 31st of 2019, which was found to be in Wuhan, China. This video is going to be comprised of information. It is an informative one. It is full of education, and it is not meant to panic anyone. We are already in panic mode. My job right now is to de-escalate the situation that has occurred and just give you all of the facts and the evidence-based information that has been released from the World Health Organization and from the CIUS. This is the agency that I work for. My hospital is a part of it. And so there has been things stipulated in place to help prevent and respond to COVID-19 here in Quebec. So it is important to understand before we dive into preventing and everything, have a little bit of information of what the virus is and how it has occurred. So it is a novelty virus. It has been around for years, and so what happened is that coronavirus belongs to the zoonotic group of viruses, meaning that it is transmissible from animals to humans, and now it has become a droplet transmissible virus between the human population. Droplet means that it is in contact with people. However, droplets also means that it could be found on a surface of some sort and can live on that surface for a shorter period of time. However, it can be still living up on that surface for about 30 minutes or so. The main focus of this video is going to be directed on prevention, detection, and responding. Specifically responding, I'm speaking of healthcare professionals and how we're treating and taking care of people that are suspected to have COVID-19 in the hospital. First thing I want to address in terms of detection, signs and symptoms, it is important to understand your body and how it's going to respond if in fact it has caught this virus. These symptoms belong to the respiratory tract. You will have a cough, you will feel shortness of breath, you will have malaise, you will have fever, almost in parallel with what someone would feel if they had the flu. In many cases, like the flu, these symptoms can lead to you developing an infection. In regards to the respiratory tract, that means you can get pneumonia, and if untreated, you can die. That's why they say coronavirus in itself can lead to pneumonia, can lead to respiratory syndrome, and the ultimate cause could be death. The ultimate way to prevent viruses and infections has remained stationary for years, and it is actually something you have learned when you are able to combine your motor skills with understanding concepts. And so that is hand washing. And I know everyone on Twitter and social media is like, oh, hand washing. Everyone hand washes, everyone washes their hands. Well, do you really think that you're properly doing it? Are you appropriately following the steps of hand washing? Do you wash your hands when you leave the house, come into the house? Do you wash your hands after eating, before using utensils, before and after leaving the bathroom, after touching a dirty knob? Do you go and wash your hands? Do you wash your hands for a minimum of 30 seconds? And do you get into the crooks and crannies of your fingers and going under your nails? Are you scrubbing appropriately? Are you using the right type of aseptic soap? Do you use hand sanitizer when unavailable to wash your hands? These are things that I would think if you really took a step back and process, you are not appropriately hand washing. People are on the go in this society, and we don't give an appropriate amount of time dedicating ourselves to cleanliness and hygiene etiquette. Hand washing is the most pressing and the most effective way of preventing any virus and any infection in general. Your hand harbors thousands of microorganisms and bacteria, and it gets into these fine lines on our hands. And so if you're not appropriately hand washing, these microorganisms are just going to build up, and you touch your face and you touch your eyes, and they're going through all of these open entries into the body, which is allowing itself to progress its way into the respiratory tract, which will be where the virus can host itself and begin to spread. Avoid going in big groups of people. In a time now where we don't have a vaccine for corona, and we don't have an antiviral medication that is specifically made for this strand, it is important that we are very careful with where we are going. Avoid old folks' homes. The geriatric population is at high risk for getting this virus, and not only getting this virus, but they can die from this because their immune system is not like yours and mine. They have weakened immune systems. They don't have the same antibodies. They're changing. Their body has weakened. Their body has grown older, and so they are at risk. And we need to protect our geriatric population. People with cancer, people that are immunosuppressed, people that have HIV, people on corticosteroids, people that are smoking. These are populations that are at risk, and even though we seem to be clinically stable and healthy, we need to be protecting these populations because as a society, it is our job and our role to protect those around us as well. The precautions are not that different from seasonal influenza. Wash your hands, follow proper coughing etiquette, sneeze in your elbow. The second you sneeze, go wash your hands. If someone sneezes near you, you should probably go wash your hands. Try avoid touching your face, your eyes, your lips, your nose, anything that has open entry to your body. This should not be debilitating the world in a way that it is. I understand the ambivalent emotions because it's almost fear of the unknown. It's a new virus. There's no vaccine for it at the moment, and we don't have a medication that's appropriately treating it. However, it is important that we understand that the less we panic, the better we can understand it. And so many things are being shared on Twitter and social media that's just completely false and untrue. The only place you should be getting your information from is those that the government's giving out to you. And I'm not talking about the news, the government. If you're in Quebec, it's like the CS going on hospital sites. You're going on the Gouvernement of Canada. And most importantly, the World Health Organization. They have the best information. It's quality and evidence-based data, and it's the only data you should be taking when wanting to properly understand this virus better, and also lessening the stress that it is putting onto you. Another thing I really wanted to address, if you are clinically stable and you're healthy, the masks do absolutely nothing for you. The second you touch the exterior of the mask, it loses its complete integrity of protecting you and loses its role in defending microorganisms from entering. The masks are only meant for two people in society at the moment. They're meant for people that are sick, that have flu-like symptoms, that people have a cough, a cold, that are sneezing, and possibly have coronavirus. And they're meant for people that are in the healthcare field like myself. We should be wearing masks before entering a room. And like I said, the integrity of the mask is lost when you begin to touch the exterior of it. After 10 to 15 minutes, the mask does absolutely nothing. This is some information I got actually from the WHO. As per Dr. Carmena Dolian, she's actually the head international health regulation secretariat at the WHO. She says that some countries have banned travel, such as in Europe, because the government chose to follow a risk assessment that it'd be best to quarantine everyone in hopes of decreasing the spread of the virus. I have to say I give props and a big chapeau off to the government of Italy. It was a big decision that they made to close off all airlines and people coming in and out of the country. It's also costly on them and it could be debilitating to them on a financial level. However, they chose the selfless way of keeping this virus where it is and trying to find a way to decrease the spread. My heart and prayers are with everyone in Italy and everyone in the world right now that is dealing with this new virus. I understand that it's causing a shock because we're seeing the numbers go up of people that are dying from it. You have to also understand people dying from this are immunosuppressed, and that is why we need to be careful of what we do, because everything that we do affects someone next to us, especially those with immunosuppressed systems. If you have flu-like symptoms and you have a cough, you have a cold, I do suggest 110%, especially today, you do go to the hospital to get tested for it. If you are seen as clinically stable and you have coronavirus, they may send you home and tell you that you have to be isolated. You may be given respiratory aid, you may be put on Ventolin, you may be put on some nebulizers depending on what your symptoms are and what it's causing inside of your lungs and the body. But for most people that have had it here, they've been sent home and been isolated. The thing that's most important is that you need to stay isolated for the time and period that the healthcare professional told you to do so. I know it's hard in this day and age. We're on the go. You want to be out. You want to be having a good time and enjoying life, especially with the beautiful weather here that we're having now in Quebec. However, you need to be thinking of not just yourself. You may be okay. It may just be like a flu-like symptom that you're having. It is corona and you're going to be able to fight over it. But the thing is that you're going to be going out into society and you're possibly going to be transmitting this to someone that isn't going to be able to fight it the way you are. And follow the guidelines that your doctor has told you to do so. Do not go to work. Do not go in public places if you're sick, because even if you don't have coronavirus, if you are sick, the chance of you getting that kind of disease is greater because your immune system now is at a lower point. Another thing I wanted to address, and I think this is crucial, I understand that this came from China. Do not hold a stigma against the Asian population. Please. I've been seeing such horrible, monstrous things being shared on Twitter about Asian population in North America being beaten up because of their race and because they think that these people caused this. We can't treat people of humanity in this horrific way. It's just unjust, it's inhuman, and it's just flat out disgusting. The spread has touched multiple countries. No one is to blame for this. Do not be ignorant. Do not hate on a race based off of where the virus came from. We need to be diligent. We need to be safe. We need to take precautions on a day-to-day basis now. But do not be in panic. I know it's easier said than done, but do not be. It's better to be rational and think and be aware of your surroundings, but do not let it debilitate your life. Alright everyone, I know that this video was supposed to be about birth control. I had promised a lot of my followers that I would be addressing this, but I feel like in a time like this, I really needed to put this video first, front and center, and I promise you I will be getting back to the birth control video as soon as I get some time. I just worked 7 days straight. I'm completely exhausted, but I really wanted to put this video together for you just because I just feel like in a time like this, we need to collectively work together and the proper information needs to be sent out there, and I thought it'd be a good way to use my platform in doing so. I really hope you guys have a beautiful day. Go enjoy the beautiful weather outside. Be safe and be cautious of what's around you. Wash your hands appropriately and think of those around you at all times. Don't be selfish in a time where this virus is having an outbreak. Have a great rest of the day, a great week, and stay healthy.